Parenting in challenging times. In this chapter, we will talk about how parents help themselves and their children with coping with the challenges of illness, death in the family, neglect, abuse, community and national disaster, and violence in the parenting that takes place during these situations.
System perspectives, source of stress for parents, and strategies for successful coping, pages 491 and 498. System and perspectives and illness and death. In these sections of chapter 17, it talks about how parents and children cope with extraordinary stresses. Yes, there are programs that can provide much help, but parents must remember that most children who experience many adversities in this course of life often get help from their own daily activities. Engaging in valued activities appear to give children more sense of self-worth, control, and social connection. It also talks about how 10% of children have chronic illnesses, and it's not talked about as often as it should be. One of the most common chronic illnesses that most children get is asthma, which affects 4 to 9% of children. The best thing to do is to discuss special sources for the parents and children to maintain family closeness and effectiveness for their situation. Children and understanding of their bodies and illnesses. In this section, it talks about how lack of information is due to children's stress and illnesses. Most children don't understand what is going on with their bodies when it comes to certain illnesses. This can make them get misconceptions of what is or has happened and their role in causing the illness. Most children get their ideas about their bodies from I can't pronounce that word. Expressions and bodily situations from time devoted to that part of their bodies. Their thoughts and illnesses also expand and become more detailed with age and time. It's best that parents and health professionals help to explore with children and all their ideas about their physical functionings and what they think is the cause of their illnesses. Anxiety and fear of the unknown. In this section, it talks about how children get anxious about shots and blood tests with which they have had experiences with. Whenever a child is experiencing fear from shots or any types of tests, the best thing a parent can do is to teach their child that when things hurt, it is okay to express the way they feel. Let them cry or shout to express themselves and assure that they will be fine. If a parent can't reduce their child's anxiety, it's best to consult with a pediatric or clinical psychologist. This will ensure to elevate their anxiety and increase symptoms and obstruct their healing process. Guilt and pain. In this section, it talks about how children feel that their illness can be a punishment of some sort that they have done in life, making them feel guilt and pain. Most children feel like it is their fault because they believe they caused it in some type of way when that isn't the case at all. Pain is also a common element of many illnesses and can be very stressful for the parent, especially for the child that's experiencing the pain. It's the parents and psychiatrist's responsibility to try and figure out what might have caused the pain to begin in a certain part of their body. The best thing to do is to keep the child on medication and to make sure they are still trying to stay active as much as possible to keep a healthy lifestyle for themselves. Anger and irritability over restrictions and demands. In this section, it talks about how children feel many frustrations due to their illnesses, and it's keeping them from doing daily activities and fun activities as well. It must be very hard for the parents to cope with them seeing their child feeling left out of certain things because of their illness. It's best to engage in the child's problems to help solve their feelings of anger and irritability. This will help ensure that the child feels loved and cared for during this difficult time. Sources of stress for parents and strategies for successful coping. In this section, it just talks about the best strategies a parent can use for their child in successful healing and coping with their illnesses. Every parent has their own way to cope with their stresses, and I think the most effective way to deal with that is to communicate and be expressive of their emotions with loved ones and close friends. Some examples would be forming a collaborative partnership with healthcare providers and working as a team, sharing information and concerns, presenting the child's point of views.
Death in the Family, pages 499 to 513. Losing a parent is always hard in a family, especially when the children are young. In the book, it stated, "Never again will the world be as secure a place as it was before. The familiar design of family life is completely disrupted." John Bowlby believed there were 4 phases of the grief process, which include a period of numbing experience, refusing to accept the fact of death, feeling sad or despaired, a period of reorganization of life. There is no idea of how long grieving will last. Children may proceed through the phases of grief more rapidly than adults. Children's special needs and talking to children, page 499. The Dougie Center believed in 4 guiding principles, which were: grief is a natural, expectable response to loss. Each individual carries within him an innate capacity to heal. The duration and intensity of grief is unique for each individual. Caring and acceptance are helpful to a person in resolving grief. Talking to children, page 499. Caregivers must be able to help the children understand or cope with the information they are being told. Even if they don't understand, as they get older, they will realize the understanding of what was told to them before and will be curious to ask questions about it. Sometimes parents will need to also be aware when telling the children about a loved one's death, because the children will feel guilty and believe it's their fault even when it's not. Ways children's reactions differ from adults. The Dougie Center believe that children have different feelings and thoughts unlike adults. For example, they believe children can be more physical with grief. Children are also less verbal, but they can express their grief with anger by being more aggressive or having an attitude. Children can also realize when their parents also need attention or help with grief. Helping children grieve. Parents should create a supportive emotional climate for children to feel safe during the grief, which include age-appropriate terms. Let them understand that they will be taken care for during this event. Keep their children with them. Express your grief in front of the children, as well as create a memorial with the family. Parents' special needs. Parents' emotions can also be like children's emotions when it comes to grief. Parents can feel anger, guilt, fear, and insecurity. Parents also need as much support as they can get as if they were a child, or if a child was going through the same situation. Being surrounded in a supporting environment is also helpful to parents during the grieving moment so they can have the support they need, as well as space. Communicating with others about your grief is also a great way to cope. Children maltreatment and bioecological view of maltreatment. Violence in the family as well as child maltreatment can be traumatizing to the children. Children can also lose trust to their parents as well as not being able to gain trust from them in the future. Ecological can be the risk factor of maltreatment. Children experience violence that are in the microsystematic level. Children's health or any characteristics that seem odd can also determine a sign if there is abuse. Factors that place families at high risk for maltreatment. It is important to understand that abuse can happen outside the home with different individuals. Home visits can help parents develop better and reliable parenting skills. There are programs that help parents with their parenting as well as helping them stay on track. Children's neurobiological responses to maltreatment. Parents can understand and see children's emotions unlike others. Cortisol can help the body during maltreatment. Cortisol includes the help of relieving stress, anxiety, and fear. Children's psychological responses to maltreatment. Children can experience PTSD during maltreatment. There can be different symptoms with the child. PTSD involves with a traumatic event and can experience PTSD either in a dream or can relieve it when they're awake. Children can most likely get triggered by something, which then can bring back some PTSD. There are different symptoms of PTSD, which can also cause feelings of being numb. Children will not be able to understand fully of how others feel or understand their point of view. Maltreated children can differ responses with their emotions or with controlling themselves. Intervention with young children. Make sure you follow the child's lead, be able to hold them and show them affection. Have the child express their feelings and emotions to emotional self to you. Show the child that you care for them and provide sacredness. Intervention with older children. Parents should introduce their older children with therapy if they feel like what they are doing isn't helpful. Family therapy can also be an option. You can follow certain structures as well as therapeutic bonds for the family.
Pages 510 to 519 by Graciela Solis. Interrupting the cycle of abuse. Positive relationships have proven to be crucial in breaking the cycle of maltreatment. In a study in Minnesota, 3 relationships proved to work in breaking the cycle of abuse. And they were mothers who in childhood had emotional supportive relationships with an adult outside the family, mothers who received emotional support and psychotherapy, and positive relationships with the partner in adulthood. Community intervention. Home visiting and parenting programs turned out to be less effective than expected. In an effort to help, programs are now being offered at the community-wide level, including Triple P Positive Program, who is on a mission to reduce abuse in South Carolina. They have effectively helped slow the rate of growth in child abuse reports, the number of children removed from their home, and the number of hospital admissions for abuse. The strengths of effective programs. The strengths of those programs that have been effective in helping children and families dealing with abuse include 1, having services provided in the home at times convenient to families, so completion rates are high. 2, services being tailored to the needs of the individual children and families using evidence-based and sound theories. 3, parenting skills and ways to reduce parents' emotional distress being taught. 4, ready access to service with consultants available when crisis comes. And 5, helping parents and children build strong relationships with people and community agencies. Foster families. There are many reasons foster parents care for children, but most often it's because parents' care has been found to be neglectful or abusive. Approximately 300,000 children are taken into foster care each year. The average length of stay in foster care is 22 months. About 20 to 25% of children will not return to their biological parents, and overrepresented among children going in foster care are children of ethnic groups with high poverty rates, including Native American, African American, and Latino families. The major law governing foster care is the Adoption and Safe Family Act. It was passed by Congress in 1997. Its mission is to provide services for families at high risk of abuse, such as parenting programs, anger management, and therapy, so that children may remain with their biological parents. If children are removed from the home, the second thrust of the program is to motivate parents to make changes in their behavior within 18 months. Failure to do so will result in parental rights being terminated. 18 months was established to help increase the possibility of adoption and a permanent home for the child. Prior to this, children stood in foster care for years waiting for changed behavior from their parents. So by the time parent rights were terminated, children were older and considered more difficult to adopt. Foster parents. There is no national registry, and the knowledge expressed in this chapter are based on small surveys. Generally, foster parents are married with an average education of high school level. About half are middle class, 15% upper middle class, and 35% are working class. 40% are single parents. Because of the numerous sources of difficulties, foster parents need to be trained to understand what children have been through, to be patient, sensitive, and warm, yet firm and supportive in helping children meet age-appropriate demands at home and school. One study found that when foster parents learned ways to stimulate verbal and cognitive development of preschoolers, they had less emotional and behavioral problems. The web of foster care relationships. Foster parents provide good care to the children. They work with agency workers to help implement reunification programs with biological parents. They work with biological parents to help them establish effective patterns of interaction with the children, including arranging or supervising visits. And at the top of the system are the judge and court who make final decisions about what will happen with the children. Such a system can work when there's a clear communication and everyone is working together for the child's best interests. Competing interests can easily surface though. Foster parents can feel critical of parents and or the protective agencies. Biological parents can feel angry to be competing for their children, and agency workers can feel frustrated with cases and their high demands. Foster children. In the earlier days of foster care, children typically came from stable families due to death or absence of a parent. As child maltreatment cases have increased, children come to foster care with many emotional and behavioral problems. As drug abuse has increased among young women, infants being sent to foster care from the hospital are making up a growing percentage of children in foster care. Little is known about their attachment experiences and how foster care will affect their development over time. A controlled study showed that children who are fostered with strangers have higher behavioral problems upon leaving than maltreated children who remained with their maltreating parents. Those who went into homes with familiar adults were less anxious, depressed, and withdrawn than those who went with strangers. Children who go into foster homes of working class and lower socioeconomic status families, who are more like the families the children were removed from, show greater success. Sadly, children in foster care are at an increased risk for abuse. Studies have shown that more reports of abuse have been made about children in foster families than those in their biological families, but the rate of substantiation is much lower for the children in foster families. Also, the rate of repeated abuse is lower in foster families than biological families. Furthermore, the abuse reported may not be done by the foster parent, but by another person in the home or the biological parent on a visit. Studies have proven foster children to have higher behavioral problems, be more likely to be held back a year in school, twice as likely to have been suspended, 4 times as likely to have been expelled, and a large number had had conflict with the law. Richard Wexler, the executive director of the National Coalition for Child Protection Reform, says, What these results should tell us is that we've got to stop throwing so many children into foster care in the first place. What you can see is, regardless of what the problems were going on, foster care sure didn't fix them. Going into foster care may well place an extra layer of stress on children. So support for the stressfulness of foster care with strangers comes from the fact that children who go into foster care, we can just get to the next one, I'm sorry. Kinship foster care and non-relative foster care. Kinship foster care, in kinship foster care, children are less likely to be moved. Biological parents appear to keep in closer contact with the children, and the parents also appear to provide greater stability, and children seem to have fewer behavioral problems there. In non-relative foster care, abuse is more likely to be reported than it is in kinship foster families. Some foster care professionals have expressed concern that in kinship foster care, children may receive fewer services and may be exposed to the same influences that created difficulties for their parents. Termination of parental rights. Parental rights are terminated when the parent proves to a court that they are unable to meet his or her responsibilities to provide adequate care for the child for an extended period of time. Parents' rights can also be relinquished voluntarily. Instant example, when young parents give up their baby for adoption. The court is concerned with the child's right to have permanent placement with parents who can care for him or her, and will make the decision if the parent proves unable or unwilling to make changes to become a competent parent. Sorry. Go ahead.
Did you want to add more?
Well, really just at the end of that last slide, I wanted to add that these decisions are not easy. Or should we go back, or are you gonna edit it?
Yeah, no, I can go back. Hold on.
Okay.
Oh, shoot.
Okay, so these termination of parental rights decisions are not easy, for there are factors such as loss of a job or loss of a home that have to be considered, and that can make the decision of taking their rights due to inability to care for the child more difficult.
Natural disasters and war. Sorry. Pages 520 to 530. Natural disasters. Natural disasters such as hurricanes, earthquakes, and tornadoes can take a big toll on families. They can be very unpredictable. This can create a lot of stress on families because they are most likely not prepared for this type of event to happen in their lives. For example, Hurricane Katrina caused thousands of people to lose their family members and or become homeless. Children who have problems before these natural disasters are most likely to have more serious problems after. Natural disasters can cause moderate to severe symptoms of PTSD. Children and teens are the main ones that are more affected by the disasters. In the book, it states, while many children show a decrease in negative feelings with the passage of time, 28% of children were still experience enough symptoms of distress to qualify for a psychological treatment 3 years after Hurricane Katrina. It also states that massage therapy was found to be helpful in reducing elementary school children's feelings of anxiety and depression following Hurricane Andrew in Florida. Children who reported many symptoms of PTSD were assigned to receive back massages twice weekly for 30 minutes or to a control group who watched him video while sitting on the lap of a research assistant for the same amount of time. Homeless families. In the book, it says that homelessness increased in the 1980s and 1990s when the number of low-cost housing decreased and poverty remained high. It is difficult to have an accurate estimate of how many people aren't homeless, but in 2006 to 2007, it estimated that about 500,000 people and families were served in shelters and transitional housing. Over 80% of families are headed by single mothers with 2 or 3 children. The major causes of homelessness are poverty, domestic violence, unemployment, and family disputes. Homeless mothers and children. To the left is going to be homeless mothers. 15% of homeless mothers are married and 27% have the post-high school education. Homeless mothers have higher rates of psychological problems like depression. Homeless mothers are most likely to have a higher rate than the general population in alcohol and drug abuse. The book says that parenting is difficult in shelters because families have limited spaces, structured rules, limit what parents can do and when. And children may have more stress in shelters. Homeless children. Being poor and being homeless also affects children just like they affect their mothers. In the book, it states children feel distressed and uncertain living conditions, and many have had the added trauma of living in homes with domestic violence. Homeless children have more problems than the average child in the population, and they sometimes are found to have more difficulties than low-income homes. The book states that in one study, 18% of homeless children more likely to have contact with children's protective services in the 5 years after leaving a shelter. Services and interventions for homeless families. Services, even though emergency and transitional housing services are a big safety net, the most important goal is to help families move toward finding permanent homes as quickly as possible and reintegrating the family into the community. This will help the families maintain and regain their independence. In addition to general mental health and community services. 3 innovative forms of intervention have been identified. First, there is provision of mental health services for families in primary health care facilities rather than mental health clinics. Second, a 7-week program aimed at helping children by empowering them and building self-esteem and positive work habits through behavioral strategies to enable them to perform better at school. A third innovative program was a multi-family group in which parents and children from several families meet with a facilitator for a retreat that occurred on a Friday night and all day on a Saturday to focus on strengthening families, giving them opportunities to have fun together, but also to improve skills in communication, problem solving, and managing stress. These innovative programs seek to give parents skills in an atmosphere of fun and respect. Here's some pictures of homeless families, military families, and some families that were in natural disasters. Military families. Military families experience a lot of stress when they are separated from their family, from their active duty member. They also are affected by moving so much. For example, I was a military child and now I'm a service member. I know how stressful not being able to see a parent for almost 2 years, with my mom being in the Middle East during a war, put me through a lot of anxiety, knowing that she might not come home one day. As a service member, I went a year without seeing my family and 6 months without communication at all. It put myself through a lot of depression and anxiety. Here's some key points. Military families includes 1.2 million children, have more stresses than most families because of separation from their loved ones and increased risk and harm. Experiences stages in deployment process and by and large cope well with the many difficulties involved. Deployment cycle. Before deployment, families are trying to spend all their time they can with their service member. They are making plans for what's going to happen during and after deployment. This builds stress and anticipation. Service members don't really get a break. They have to continue their job every day. So that means they have a hard time spending time with their families right before deployment. Deployment is the most stressful experience being in the military and being a military family. Reuniting with your family after deployment is the best thing ever. But going so long without seeing each other, you can learn so much has changed. Some service members miss major events in their families' lives, especially children growing or being born. Some children, like this is an example, some children that are away from their parents too long at a young age tend to forget their parents sometimes. That happens in a lot of like babies and toddlers. But sometimes during a deployment, service members or family members grow independent and change from what they are used to. Family changes. It is estimated that 1/3 of returning soldiers suffer significant distress with PTSD, depression, and substance abuse being common problems in the group. Between 20 to 40% of wives of men with psychological problems also report problems of depression, but more in relation to their own lives and past experience than in response to their husband's problems. Children under 12 have increased healthcare visits for health and emotional problems. Also, an increase in feelings of anxiety and depression, as well as aggressive behaviors and problems at school. Teens usually show emotional behaviors of sadness and anger. This affects their performance at schools and their interactions with peers. All this is caused when parents are off on deployment. The military provides services for families that are going through stress while their service members are on deployment for long periods of time. The book says that general services provided for all can focus on building general stress management, coping skills to prevent psychological problems in the deployment cycle. And the challenging model key points focuses on strengths people develop to cope with negative family experiences or other traumas. Identifies 7 resiliencies: insight, independence, relationships, initiative, creativity, humor, and morality, and presents an optimistic view of people's capacity to create satisfying lives despite the scars of painful experiences.